Good afternoon to all the homeopaths and everybody who have joined this meeting. I feel very fortunate to have you all here. I, Dr. Anushri from Radaropus team, welcome you all in this presentation. I feel very fortunate to present this topic, a case presentation on hypothyroidism with Radaropus in front of you all. I want to thank BJN RX and BJN Publications for giving me this opportunity. Now we will start with a basic introduction about hypothyroidism. So, hypothyroidism is a clinical state resulting from underproduction of the thyroid hormones that are thyroxine or tetraiodothyronine T4 and triiodothyronine T3. Etymology of hypothyroidism. The word hypothyroidism is from Greek, hypo meaning reduced, thyros meaning shield, and eidos meaning form. Hypothyroidism is listed in the International Classification of Diseases under ICD-10 code E03.9 under the range endocrine, nutritional, and metabolic diseases. Hypothyroidism is characterized by a broad clinical spectrum ranging from an overt state of myxedema, end organ effects, and multi-system failure to an asymptomatic or subclinical condition with normal levels of thyroxine or T4 and triiodothyronine or T3 and mildly elevated levels of serum thyrotropin. So basically hypothyroidism is defined as low levels of blood thyroid hormones due to the destruction of thyroid gland. In this condition, the thyroid gland is stimulated properly, but it is not able to produce enough hormones for the body to function properly. Now, coming to the epidemiology of hypothyroidism, the prevalence of hypothyroidism and thyroid disorders. So, hypothyroidism is one of the most common thyroid disorder in India, affecting approximately 1 in the 10 adults in our population. The prevalence in India is 11%. This hypothyroidism is up to 8 to 9 times more common in women than in men, and the prevalence increases with age, with a peak incidence between the ages of 30 and 50 years. So it mostly affects between the age of 30 to 50 years and most commonly found in women. And hypothyroidism is not only a burden to India, but it is also a global burden with a prevalence of about 4% in the US and about 2% in United Kingdoms. Now coming to the different types of hypothyroidism. So hypothyroidism can be classified as primary hypothyroidism, secondary hypothyroidism, and tertiary hypothyroidism. Firstly, about the primary hypothyroidism. Primary hypothyroidism is defined as low levels of blood thyroid hormone due to the destruction of the thyroid gland. This destruction is usually caused by autoimmunity or an intervention such as surgery, radioiodine, or radiations. So, The primary hypothyroidism is due to the destruction in the thyroid gland. The defect lies in the thyroid gland. In the HPA axis, the hypothalamus pituitary axis, the defect lies in the endocrine gland. Now, coming to the secondary hypothyroidism, in the secondary hypothyroidism occurs when the pituitary produces insufficient TSH. That is, the defect lies in the pituitary gland and the gland is unable to produce the sufficient amount of thyroid stimulating hormone. And now the tertiary hypothyroidism. In tertiary hypothyroidism, it occurs when the defect lies in the hypothalamus. That is, there is deficient TRH secretion. The thyroid releasing hormone is secreted less. That's why the thyroid stimulating hormone is secreted less. So we can understand these types by easily understanding the pathogenesis. So the hypothalamus secretes the thyroid releasing hormone, which stimulates the pituitary gland to secrete the thyroid stimulating hormone. And this thyroid stimulating hormone stimulates the thyroid gland to secrete its two hormones, that are triiodothyronine and tetraiodothyronine, T3 and the T4 hormones. So in the case of hypothyroidism, as the T3 and T4 are not produced properly, they are not produced properly by the thyroid gland due to the defect in the thyroid gland. It generates a negative feedback on the pituitary gland, and then the pituitary gland increases the thyroid stimulating hormone secretion, so which leads to the high amount of thyroid stimulating hormone, high amount of TSH in the blood. That is why you get high TSH levels due to hypothyroidism in the blood tests. Now coming to the risk factors, the various risk factors for hypothyroidism. So the risk factors include autoimmune diseases, and most commonly the autoimmune diseases with which risk for hypothyroidism is the Hashimoto's disease. Second risk factor is total or subtotal thyroidectomy. In the cases of cancers or Hodgkin's lymphoma, sometimes the thyroid gland is removed totally or partially. In that cases, the patients may suffer from thyroidism, hypothyroidism. Radiation treatments, if someone is getting a treatment of radioactive iodine 131I, that can dispose the patient towards hypothyroidism. Some may have congenital hypothyroidism or from birth. Some persons may suffer from hereditary tendency of hypothyroidism. If your remote ancestors are having hypothyroidism, then you can have a tendency of having hypothyroidism in yourself. Thyroiditis can lead to hypothyroidism. Medicines such as lithium, amiodarone, interferon alpha, interleukin 2, and newer drugs that are used in the cancer treatment such as ipilimumab, pembrolizumab, and nivolumab, that can also lead to hypothyroidism. Too much iodine, too little or too much iodine can also lead to hypothyroidism. So these are the basic risk factors that can lead to hypothyroidism in one or other. Coming to the sign and symptoms of hypothyroidism. Hypothyroidism symptoms may include tiredness, more sensitivity towards the cold, constipation, dry skin, weight gain, puffy face, hoarse voice, coarse air and skin, muscle weakness, muscle aches, tenderness and stiffness, menstrual cycles that are heavier than usual or irregular, thinning of hairs, hair falling, slowed heart rate, also known as bradycardia, depression, and many are memory problems. So these are the all sign and symptoms you can get in an hypothyroidism patient. Now these are some dietary recommendations, the foods that are good or bad for hypothyroidism patient. Some raw cruciferous vegetables. These vegetables contains goitrogen products. The vegetables containing goitrogens increase the thyroid hormone in your blood. Packed beverages, fast foods, carbonated drinks, these all things increase the oxidative stress in your body, thus increasing the thyroid hormone in your body. Soya fruits, wheat, and breads include this all includes gluten. So gluten can also increase your thyroid hormone. So mostly the products containing goitrogens and gluten can increase thyroid in your body. The foods that are a good choice in cases of hypothyroidism patient are nuts, lean meat, eggs, probiotic rich foods, lemon, walnuts, honey, vegetables, beans, shellfish. So these are all the foods that you can suggest to your patients of hypothyroidism. Now, as we have looked on the basic introduction about the hypothyroidism, we will now continue with a case. So this is my case. This is a case of a female aged 53 years, height 5 feet, weight 68 kgs, living in Noida, married, a Hindu female. She presented with the complaints of tiredness since 3 months. She complained that she had no desire to get up for work, mostly in the evening and in morning. She said that when I used to wake up, I have no desire to wake up for any work. So she was feeling tiredness. She complained of swelling or puffiness of face since 3 months. That was more in the morning. She complained of weight gain since 2 months. She told me that her weight shooted from 58 kgs to 68 kgs in the past months. She also complained of weakness of the lower limbs since the 1.5 months. Since 1.5 months, she was also suffering from the weakness of the lower limbs. She told that she was apparently well 3 months back, but when she gradually started feeling the tiredness in the evening and then the tiredness in the morning with no desire to work and get up, puffiness of the face in the morning, and weakness in the lower limbs. Then she said that she noticed that she is gaining some weight. In the past history of the patient, vaccinations were on time. COVID vaccine, she took one dose only. There was a surgical history of cholecystectomy approx 6 months ago. No history of any accidents, hospitalization, or drug reactions were found in the past history of my patient. In the family history, on the paternal side, her father was expired. Her brother suffered from diabetes mellitus too. Her sister suffered from hypothyroidism. In the maternal side, her mother was also expired. She expired with CA gallbladder, and her My aunt also expired. She expired with DM2 and hypertension. So this was the family history of my patient. The personal history, all the developmental landmarks were on time. Habits and addiction, nothing was found specific. Diet, she was vegetarian, married, housewife. No allergies were found. All the surroundings at her home were congenial. Nothing specific in the hobbies were found. And she was a graduate. So this is the personal history. Coming to the physical generals of the patient, she told me that her appetite was normal with 3 meals per day. She took 3 meals per day, 1 to 2 chapatis per meal. Her thirst was 1 to 2 liters per day. Desire for salt was very marked in her. When I asked about the desire, she just told me salt. I like salty things and I cannot eat a food with less salt. No specific aversions were found. She told me she have intolerance towards strong odors, tongue clean and moist, taste of mouth, nothing specific was found, sleep 7 hours per day, refreshing, urine 4 times a day, 4 to 5 times a day, nothing at night, pale yellow and non-offensive urine was there, stool was only 1 time a day, satisfactory, perspiration was on scalp. Menses, she had menopause at the age of 45 years and thermal reaction is hot. Mental generals, she had fear of thunderstorms. Whenever there were thunderstorms, she used to close her doors and windows. She tends to weeps alone whenever she used to cry. She used to cry alone only, but never she used to complain. She will never share her complain about with her family. She took responsibility very seriously. She had desire for company and she had anxiety about the health of her own. So these were the mental generals. So the totality of symptoms I made with my case is fear of thunderstorms, weeping alone, took responsibility seriously, company desire, anxiety about the health of her own, desire salt, intolerance strong odor, perspiration, scalp, tiredness with no desire to get up for work, more in the evening and morning, puffiness of face, more in the morning, and weakness of lower limbs. So this was my case, doctors. This is Dr. Anushri. Now we will work with the repertorization of case using the Radaropus software. If you have any queries, kindly type in the chat box. So let us quickly move towards our software. I just open my Radaropus software. So this is how the Radaropus software looks whenever you will open the software. This is how the software will look. You can see the screen of the software is divided into two parts. One is the left hand side of the screen and the other is the right hand side of the screen. On the left hand side of the screen, you will always see the table of contents in your software. And in the right hand side of the screen, you will always see the contents of your given input in the software. So let us just quickly understand about the basic toolbar and the primary icons of the software. And then we will go to the repertorization part of how I will repertorize using the Radaropus software and come to my precise remedy for the case. So this is the basic toolbar of the Radaropus software. And these 5 are the primary icons of the software: repertories, references, patients, remedies, families. So these five are the primary icons of the software. So let us just take a brief information about these primary icons of the software. So by clicking on this repertories icon, I can open the whole table of content of all the repertories present in the software. You get more than 30 plus repertories with the Radaropus software. If you want to search any repertory, just type the initials of it. Suppose I want to open Kent. Type the initials, click on Kent, and your repertory will be open in the right hand side of your page. So likewise, you can open your repertories. Coming to the references icon, with this references icon, you can read the extensive library of Radaropus. With the Radaropus software, you get more than 1600 plus books with the software. If I want to open a book, just click on the book and your book will open on the right hand side of your page. So this is how you can use the references icon. Coming on the patients icon, with the patients icon, you can create a new patient and you can see the old patients. With this remedies icon, you can see the whole table of content of all the remedies present in the software. There are about 8500 remedies in the software. Whichever remedy you want to read, just type the initials and click on your remedy. Your remedy will be open in the software. Likewise, coming to the families, there are more than 5500 families in the software. You can scroll and select the different families, or you can just search about them by typing the initials of your family, clicking on it, and you can gain the whole information about a family with the software. So this was the basic information about the primary icons. Now going to the repertorization part. So I will just quickly open my Synthesis Adonis repertory. Synthesis Adonis repertory is the successor version of Synthesis Treasure Edition. It is the most advanced and updated repertory of this time. So I am using my Synthesis Adonis repertory. So this is how your repertory will look whenever you will open it in the software. This is the repertory view of the software. You will see these basic icons in the software: binocular icon, clipboard icon, remedies icon, and the author references icon. So today for repertorization, we will use these two icons, the binocular icon and the clipboard icon. By clicking on this binocular icon, I can open this navigation window. This navigation window comprises of the different chapters of the repertory. I can go through all the chapters of the repertory using this navigation window. So let us quickly search for the rubrics in our case. In my case, so I will navigate the rubrics of my case using the Radaropus software. So my first symptom was, the patient's first symptom was desire for company. So it is a mental symptom. So I will search in mind. So I will just open my chapter mind, and my patient has desire for company. So I am typing company, desire, and here is my rubric, mind, company, desire for. Now for adding the rubric in the clipboard for analysis, I'm using the first way, that is this clipboard icon. By clicking on this clipboard icon, my rubric will be directly added in the clipboard for analysis. Now pressing the backspace key, I will go back to my chapters. The second symptom of my patient was She used to weep alone. So this is also a mental symptom. So I'm opening the chapter Mind, Weeping Alone, enter, and I have opened my required rubric, Mind, Weeping Alone when. Now the second way of adding this rubric in my clipboard is dragging and dropping. So I am dragging my rubric and dropping it in the clipboard for analysis. Now I will again take a mental rubric. Mind, responsibility. She took responsibility very seriously. So I am finding a rubric of responsibility. Responsibility, taking responsibility too seriously. So this is my rubric. Now the third way of adding is press your plus key on your keyboard and you can add your rubric in the clipboard for further analysis. Pressing the backspace key, I will go backwards in my mind chapter. Now again, I want to take another mind rubric, another mental symptom of my patient. My patient also had anxiety for her own health. So I will search anxiety, health, own, and this is my rubric. I will drag it and drop it. Now I am taking another mental symptom, the final mental symptom of my patient. She had fear of thunderstorms. So I am taking this fear, thunderstorms, and by clicking on this clipboard sign, I have added all the mental rubrics of my patient. Now, coming to the next symptom of my patient, she told me that she had swelling of her face more in the morning. So, pressing the backspace key, I will go backwards to my chapters. Now, I will open the chapter Face, Swelling, Morning, and this is my rubric, Face, Swelling, Morning. Pressing the plus key, I have added my rubric. So this is how we can navigate the rubrics. Now the next symptom of my patient was weakness. She was feeling weakness in the limbs in the morning. So I will open generals, weakness, lower limbs. She told me that she had this tiredness in the morning. She had this weakness in the morning on waking. So I am taking it as a general weakness morning on waking. I am adding this rubric in my clipboard for analysis. So this is how we can navigate the rubrics. Now we can also navigate the rubrics using the search function. So we will now search the remaining rubrics using the search function, the versatile search function of Radaropus. Firstly, we will do a normal search. Suppose my patient had the symptom of weakness in the lower limbs. So I am just typing so these are all the rubrics, and this is my rubric: extremities, weakness, lower limbs. Drag it and drop it in the clipboard for final analysis. Now I am finding the remaining rubrics using this advanced search option of Radaropus. Now my patient had this intolerance to strong odors, so which we could find in nose, smell, acute, and I am searching in advanced search. So I have all the rubrics of nose, smell, acute in the different repertories. And as I am doing in synthesis Adonis, my repertorization is using the synthesis Adonis. So I will select this rubric, drag it and drop it. Now the next symptom of my patient was she had desire for salt. So I am adding the next rubric. Just search for salt desire. And I have all the rubrics for salt desire. I am taking this rubric, generals, food and drinks, salt desire. Now the final symptom of my patient was she had perspiration on the scalp. So I am adding these words in my advanced search and search. So I have all the rubrics for perspiration of scalp. Selecting this first rubric, and this is how we can navigate and search for the rubrics using the Radaropus. I have found all my symptoms using the software, the precise rubrics for my symptoms of my patient. This is the analysis of the case. This is my patient's case analysis. You can see all the 11 symptoms that were in the totality are here as the rubrics we just took. So these are all the rubrics. This is the analysis chart, the different remedies. So the first and the primary medicine coming according to Radaropus software is phosphorus. Phosphorus is covering all the 11 symptoms, all the 11 rubrics, and it has been giving the highest marks, 30. The second is lycopodium, covering 10 symptoms and given 20 marks. So this is how you can see the remedy differentiation in the analysis. So this is how I did my case analysis. This is the repertorization. Now going back to the presentation. So after analyzing with Radaropus, I prescribed the genuine medicine phosphorus 200, one dose stat and Seclac 4 globules 3 times a day. I also advised her the general management of the diet changes. I advised along with the medication, the diet changes, and she was also advised with some mild regular exercises for 20 to 30 minutes per day. In the first follow-up, she told me that her tiredness was slight better. Her puffiness was also getting slight better. Her weakness in lower limbs was also slight better. So I prescribed Saclac 4 globules 3 times a day. And I advised her to continue with the same general management as I told her on the first visit. In the second follow up, she told me that her tiredness is now not improving And she also told me that none of the presenting complaints were improving. Her weight was 66 kgs now. So then I prescribed phosphorus 1 1 dose stat and advised her to continue with the same general management. In the third follow up, her complaints, the primary complaints of the patient were better. She told me that her tiredness was better, her puffiness got better, her weakness got better. Her weight was also 63 kgs now. She reduced 5 kgs in 4 months. And prescription was Saclac 4 globules 3 times a day. So now you can see the lab test report also of my patient. When she came to me, her TSH was 8.7, and after the treatment, her TSH was 3.01. Because of the genuine medicine phosphorus we gained through the analysis by the Radaropus software. So this was the case presentation of hypothyroidism using the Radaropus software. I thank you all for joining and patiently listening. And you can call at this number 8800872755, the number that is reflecting on your screen, or you can directly visit us at www.bgenrx.com, and you can raise your queries regarding cost